I'd like to welcome a very special guest, Dr. Kursat Bozkurt. Dr. Bozkurt is a professor of cardiovascular surgery at the Istanbul University. He served as the president for the National Vascular Surgical Association, the Asian Vascular Association, the Turkish Society for Cardiovascular Surgery, and the UIP 2022 World Congress. He is currently the president-elect of the European College of Phlebology and the General Secretary for the UIP. Welcome.
Thank you, thank you, thank you. First of all, I want to thank for the invitation. It's a very perfect, nice scientific atmosphere. I love that kind of atmosphere. Thank you, Anil.
So can you tell us a little about Turkish glue? You've been in this field for a long time, and you've seen a lot of what is Turkish glue and where it came from.
Right. In reality, the scenario started in 2012. Uh, with a company originated from Turkey, we were searching something to do further than thermal techniques. I mean, they were producing laser catheters, they were producing radiofrequency catheters at that time. And we just in search of some further developments. I'm a thoracic and cardiovascular surgeon. In my training, I also have some thoracic experience. And in reality, I was using glue, cyanoacrylate glue, for different indications, like for bronchopleural fistula, and even we did use glue for some pulmonary artery aneurysms. There's a disease in this country called Behçet's disease, is a some sort of autoimmune disorders, and pulmonary artery aneurysms is quite often in this disease. For example, we published a paper for that, and we did use glue for ruptured pulmonary artery aneurysms for some that. And we were thinking how we can use glue, I mean, as a theory. It was as a theory. Then I saw the publication of Jose Almeida in 2012, and it was the first human application for glue. Then starting from that point, we also started to work on glue for varicose vein pathologies. What we did is, first of all, we did some experiments on different models, rabbits and in some sheep models. We did some experiments, and then we were able to find a cyanoacrylate glue which can be used for human veins as well. It was 2 years after Jose Almeida paper, which was published in Journal of Vascular Surgery. And then we finished all of the details, and we started to use Turkish glue in 2014. At that time, Venasil became also available, and Nick Morrison published the first series in 2015. So Venasil was always 1 or 2 years before than us. We developed a different glue because we thought there are some disadvantages of Venasil. For example, the polymerization time is quite long in Venasil. In some part, it is advantage, but in other part, it has some disadvantages. So that's why we developed a different type of glue and also a different type of application system. For example, for Venasil, you have to use standard Seldinger technique. Sometimes it may be cumbersome, sometimes it's time consuming. And instead of, for Turkish glue, we developed a introducer system, and you can directly send the PTFE application catheter with 6F introducer. So there are some minor differences, but believe me, at the end of the day, this is also cyanoacrylate glue, and I should admit the original material is coming from the United States, but the composition is different here. We are adding some other materials in order to make the glue more liquid and easy for use. So what we did is we planned an initial human study after experimental models. And what we did is we did a patient study for 300 patients. We compared laser with cyanoacrylate glue. You can ask me, why laser? Because at that time, we were using more laser catheters than radiofrequency ablations. For example, in my current practice, if I want to do thermal technique, I love to go to radiofrequency ablation, but at that time, I was using mostly laser devices. So one group cyanoacrylate, one group laser ablation, and we did over 300 cases. We followed them for the initial study 1 year. What we did see is the results are pretty good, really good. The closure rates is over 94%. The complication rates were quite low, and it was very easy procedure. Believe me, you can do one Turkish Glue application in 5 minutes. I'm not exaggerating. I'm not exaggerating anything. In 5 minutes, 10 minutes time, you can just put a cannula and directly you can give the Turkish Glue. So in 2016, we published our first data in phlebology. In 2015, Venasil published first series. Then in 2016, we published our series. The results are very, very good. Then what we did is, Venasil is a big name. Venasil is a very important company, very big company. And what we did after that is we started to do some webinars. We started to do some face-to-face meeting in order to distribute the Turkish Glue everywhere in the world. I was in everywhere in the world. Turkish Glue now have a license almost in every country except United States and Canada. The company are working for United States and Canada as well, but I mean your rules are very strict, unbelievable. In some part it's okay. I mean should be like that, but it's really unbelievably difficult. For example, in almost all of the European countries, it's okay. In Far East, in China, Malaysia, in other countries, in Gulf countries, Arabia, yes, you can use Turkish Glue without a problem, but in United States, it's a problem. I don't know when it may be available in United States. I don't know, but possibly it will take a bit more time to use it in there. Now, if we speak something practically, where are we in the current station in terms of glue? In every meeting, in every phlebology meeting, I'm giving lecture for glue ablation, and people are started to think I'm using only glue. No, it's not. Definitely, it's not. First of all, in 2020, we published European College of Phlebology guideline. And in this guideline, I clearly stated 1A recommendation in thermal techniques. There's no question about it. Always thermal techniques has priority because we know the results. We know 10 years results. We know 15 years results. That's why none of the techniques can compete now with thermal techniques. What I am saying is, a surgeon, a phlebologist, whoever he is, should have some choices in the hand. For example, one thermal technique, one non-thermal technique. For thermal technique, I like radiofrequency. As a non-thermal technique, I use glue and foam. So how I select the patients? First of all, in my country, we are very lucky. We have full reimbursement for all that techniques, including glue. So an ordinary Turkish patient can go to a hospital, no waiting list, believe me, no waiting list, can get glue ablation, no problems. And the patient is not paying anything from the pocket. It's a big advantage for us. That's why we can tell the patient all of the choices. For example, if the size of the vein, the dimension of the vein is over 14 millimeters, I directly go to thermal techniques. I mean, why, I gonna put myself in a stress? Why I gonna, there is a big possibility of recurrence. That's why my threshold is 14 millimeters, okay? Above 14 millimeters, I just go thermal techniques. Doesn't matter which one is. But if the size of the vein is below 14 millimeters, and if the patient wants a non-thermal technique, I just suggest them glue ablation. What I am doing is I am putting the tip of the I am putting the catheter below, mostly in many cases below the knee, advance to the saphenophrenic junction, and put the tip of the catheter not 5 centimeters, 2.5 centimeters below saphenophrenic junction. I'm sure Dr. Hingorani is going to ask me, Kursat, is there any possibility of deep vein thrombosis? Glue may go there, something like this. If you are using Turkish glue, it's not a big possibility because the polymerization time is only 5 seconds. As soon as the glue contacts with blood, pew, sudden closure. So that's why if I'm using Turkish glue, I do not hesitate to be close to the junction. Not very close, not 1 centimeters, but if you are putting in 2.5 centimeters, it's almost flash occlusion. You can see. I personally haven't seen any glue inside the deep vein so far, in my experience. But a couple of months ago, I had one patient from eastern part of the country. They glued saphenous vein, but unfortunately, they also glued a the femoral vein. So it's a complication. What I am saying is, to be close to the saphenofemoral junction, it's not a very straightforward procedure. Yes, you can do it, but need some experience, and you have to press very nicely to the saphenofemoral junction. And I had to operate that patient 2 weeks after the glue ablation procedure. Inside the vein was like something like carotid plaque, and easily I took it out. So my experience with glue is nice. Size is important. The patient expectation is important. For example, some patients doesn't like needle. Needle phobia is a important indication. Varicose stockings now in August here in Istanbul, and outside is 40 degrees Celsius, 40 degrees Celsius. So you can't put varicose stockings here now. It's not practical. So if the patient doesn't want to use varicose stockings, needle phobia, small dimensions, I use glue. And finally, you're gonna ask me possible complications. In 2% of the patients, we do see some allergic reactions. We haven't seen in this country granuloma formation after glue ablation. Yes, there are some reports from UK, from United States, but we haven't seen so far. I am getting all of the complications of glue in this country in my database. No, we haven't seen so far. Maybe we will see, I don't know. But so far, granuloma, we haven't seen in this country. I haven't any experience to excise saphenous vein because of the allergic reactions so far. I mean, we haven't seen it. But as I told you before, we should be very careful in selecting the patients. And also, I'm always saying, always, we should start inside the saphenous fascia. Okay, if the vein is very superficial, it's not good idea to use glue. I mean, as long as you are inside the saphenous fascia, it might be short saphenous vein, long saphenous vein, doesn't matter. You are safe. Don't worry about it. Am I speaking too much?
No, no, it's good. I actually, you covered a lot of my questions, but I did want to add, there's glue here in the US is much more expensive as compared to thermal ablation. And some insurance companies don't cover it. You don't have that problem. But in terms of cost, how much does Turkish glue cost as compared to the Venusseal or thermal ablations?
I really don't know. I really don't know how much is Benassi. But these Turkish companies can sell down to 300 US dollars. They can sell. They able to sell with 300. It's a company price. Maybe distributor will add some money, something like that. But just say 400, 450, not more than that. So I think Turkish government is paying back 300 US dollars for Turkish glue. Oh, it's cheap. It's really cheap. And same glue, cheaper. We can use it. Laser, in terms of laser, uh, again, depends on the quality, depends on the which one is that. But roughly, I think 50 thermal catheters are $50 cheaper than glue. So if you can say 300, for example, for glue, it should be 250, something like that.
But it's still very similar in terms of the cost. So I think, at least in your numbers, the numbers that you have in Turkey, they're fairly comparable. So thank you so much. This was really, really helpful. I love the history, hearing about where all this started, because we sometimes only talk about the present day results, but they're also reflected upon where the technology has been. Where do you see this technology going, though? The next step? With Turkish glue?
Um, I think Turkish glue is now in a good way and in a good composition. We are not thinking to change anything in the composition of Turkish glue, delivery system. I mean, they are all fine. The only question for all glues is this allergic reactions. I mean, this is a problem, and I think we should be careful for a while. We should see the 10 years result. One group in Turkey has 8 years follow-up result, and they published it. It's good, but still, these allergic problems might be a negative factor for glue. But otherwise, I can't say anything about Turkish glue. It's okay. It's fine now. What we should do else?
Perfect. Thank you for bringing up this new innovative technology. I think it's going to continue to spread worldwide, and you've been the leader in this. So thank you so much.
My pleasure. Thank you, Anna. Thank you. Bye bye.